Hello and welcome to another episode of Conversations with Dr. Westman. Today we're going to be chatting about keto and hormones. Hi, Eric.
Good. How are you doing?
Very good, thank you. So, Eric, it's been put out there that a strict keto diet can affect cortisol levels, which in turn could affect weight loss. What are your thoughts on this?
So what you eat and how you live affects the hormone levels, no question. In fact, when I think of food and hormone levels, regardless of what diet you do, the most important hormone that gets changed by different types of food, in my mind, is insulin, because insulin is affected differently based on the carbohydrate that you eat. The sugars and the starches raise the blood sugar going up raises the insulin, and then insulin elevation has many different downstream effects, and including affecting the other types of hormones, the reproductive hormones, causing insulin resistance, and adrenals, where the cortisol comes from. So I've heard this kind of, there are a lot of, for 20 years now that I've been studying and using low carb and keto diets, I've heard lots of, unfounded things that are said about it. It's almost like there's a prejudice that everyone knows that it's bad. They're prejudging the diet. In my experience, the stress levels and cortisol levels actually get better on a low-carb keto diet as someone's losing weight. Again, the context depends, is important here. If someone's losing weight using a keto diet for that, I don't worry about anything other than lowering the insulin level and the weight loss, then diabetes gets better. Cortisol is kind of a secondary issue. Now, if you are doing a keto diet and you're not losing weight, stress levels from other parts of your life can affect cortisol, and I don't think of the diet being the biggest factor there. In general, 99% of the time, keto and low carb fixes these other things over time.
I try to go back and I want to just discuss something quickly. You mentioned insulin, and the reason why I want to go back to it is that most folks probably aren't aware, as I wasn't, that insulin is actually a hormone. So just wanted to pop that in there. Do you feel, or do you find that in your clinic, women seem to be more affected by hormonal changes due to the diet than men?
Well, sure. There's the hormone cycling that women have, unless they have a condition like polycystic ovary syndrome, where so just the monthly menstrual cycle is a cycling of hormones that happens. And in general, a keto low-carb diet, because you're taking away the carbohydrates that cause the insulin to go up, and the insulin going up over time causes insulin resistance. Because there's too much insulin around, your body becomes resistant to it. That can affect the reproductive hormones, and in some people cause the menstrual cycles to go away. So a common cause of infertility is the condition called polycystic ovarian syndrome, or PCOS, and that normalizes. In fact, that can get better really quickly on a low-carb diet, even without weight loss. So the carbohydrates signal the blood sugar signals the insulin causes insulin resistance, and then that is the root cause for many of these cortisol, estrogen, menstrual cycle, fertility issues. I really like looking at root causes, not give pills and products and vitamin supplements to make you think like you're fixing it when you're really just managing it.
Now, I was very, very careful with the choice of words that I used in the beginning there, and I mentioned that it had been said that people said that cortisol levels had, would rise on a keto diet. There's two more that I'd like to ask you about, and that is estrogen and thyroid, because those three seem to be the most common, hormones that are reported by people to have changed when implementing a keto diet. Yet, as far as I'm aware, there's no science that says this. So I just wanted to find out in your clinical perspective, anything to do with estrogen or thyroid while implementing a keto or low carb diet.
Yeah, the big picture view is that the levels of hormones and even ketone level and glucose levels, which aren't hormones, but they're influenced by hormones, these may actually be different. The normal range, or you might measure a thyroid level, for example, and it might be out of the normal range, but the normal range is determined by those who eat carbohydrates. So all of our Western medicine normal ranges are determined by the people who get checked, and just about everyone eats carbohydrates. So you might have a thyroid level, and I've seen this written about extensively by folks who don't take care of patients. They're just waxing or talking about the biochemistry. You might have an abnormal thyroid level, but your thyroid function is normal. So we don't treat a number, unless it's we don't treat a thyroid number or an estrogen number. It's the function of that hormone that you want to be sure is either abnormal or not. I mean, checking a level can clue you in, but it's really the whether the hormone is working adequately or not. And so, in my world, the measurement of thyroid, I do it all the time. And you want to make sure you're looking at not only the TSH, which is the stimulating hormone, but also the actual hormones themselves, the T3 and T4. And I mean, it's important to do that, because if someone comes to me and they're 100 pounds too heavy, they may feel tired and have no energy, which could be a symptom of low thyroid. But I have to admit that just about all the time, the thyroid level is normal, and I don't use thyroid replacement. All I do is change the food, and everything gets better. So the actual number that you see might not fall into the normal range of the test that you've received, because that normal range is from people who eat carbohydrates. An example of that is on a keto diet, your ketone level is a little higher, beta hydroxybutyrate, if you checked it, and it falls outside the normal range because those who eat carbohydrates don't have ketone or beta hydroxybutyrate in their blood. That actually causes confusion for someone who has type 1 diabetes, because in the past, if you eat carbohydrates and you have ketones, then you worry about ketoacidosis. So if someone feels well, they're doing a keto diet, even with type 1 diabetes, and they're taking insulin and they feel well, you don't worry about that. But it's a very charged subject, because for type 1s, you fear ketoacidosis. I mean, it can be life-threatening. So I think that's why a lot of the normal range is determined by those who eat carbs. So you might not be in that normal range. There are these adaptations that occur. Your insulin may be high because of insulin resistance and extra weight. And as you lose the weight, the insulin level goes down and the insulin resistance goes down. And that's a good thing. So it may be that if you're off the normal range, even for a thyroid level, but you feel fine, it may be that whatever was a thyroid resistance sort of thing is now gone. So I see people come in with reams and reams of data and numbers and tests, and you can send away for, hundreds of tests. And I don't really put a whole lot of value in treating those individual things, because treating the root cause has all of these downstream effects and improvements in those things.
I'll tell you, Eric, there's every time when I think that I've learned enough or sufficient in this particular area, I seem to remind myself that there's still a lot more to learn. So you've given me a lot of food for thought here today.
I learn all the time too.
All right. So let's move on to some of the questions, see if we can help some folks with their questions. Natalie asks, if I am menopausal, should I be doing strict keto? I'm overweight and have type 2 diabetes. I know the answer to this question.
Well, sure. Yeah, I think keto is good for anyone as long as you're not like consuming products and oils. And so my version of keto that I've studied and used clinically for 20 years now does not include these new products and pills. And so I prefer and recommend teaching using real foods. And eating real foods is a healthy thing to do. We don't need to eat carbohydrates. It's actually not a essential nutrient, which is the term for something you must eat because your body can't make it. So just eating proteins and fats is a healthy thing to do, even if you're menopausal or perimenopausal. Now, the insulin resistance, which makes things harder for weight loss, and to make something like this work, you need to keep the calories or the carbs really low. You may find if you're perimenopausal or postmenopausal that you have to keep the carbs really low. We use a 20 gram per day kind of threshold, or the 20 gram rule, we call it, because just about for everyone that will work at 20 grams or less. And by 20 carb grams total, not net. But that is getting, but yeah, I think keto is fine as long, I've seen some people get distracted by all of the, even now I teach using the internet and all these ads come up, and I find myself saying, you don't need those things because now there are all these different shiny distractions. I prefer real foods, recommend eating a real food, low carb keto diet. And I've seen this work in women who are menopausal where other things didn't work. So yeah, that again my clinic is full of people who've tried just about every other sort of method. And it just kind of defies sensibility. I've had people go for weight loss surgery twice, and I ask them, have you ever tried a low carb keto diet? And they say no. So remember, we've come through a time when this was thought to be something bad to do. And the mindset of many doctors was that it's safer to do weight loss surgery than to do a low carb diet, which is crazy.
Yeah.
I mean, it's much safer to do a low carb keto diet than to have bariatric surgery.
Wow.
That should be obvious, but a lot of doctors don't know. And a lot of people will come to this for the first time when they're postmenopausal, which is fine. It'll still work. In my clinic, I use the low carb keto diet as the first line treatment. By default, I'll use it and then use other approaches if necessary. But, just about everyone in my clinic does really well on a low carb keto diet because I keep the carb grams really low at first.
I've got a question here from Ben, and he asks, I want to start keto, but worried about my testosterone levels. Will they be affected? Again, I would imagine there's no science that shows that it does. What is your experience there?
Yeah, so no published studies that I'm aware of. The keto diet or low carb or carb cycling actually has been used in the bodybuilding world for a long time. And these folks are very concerned about testosterone and to the extent of how the muscles look. And in my experience, testosterone gets better just by changing the food, and that's cutting the carbs out. And if you have weight to lose, weight loss, however you do it, improves the testosterone level. It turns out our fat cells are metabolically active. They don't just store the fat; they actually secrete hormones and chemicals. And there's kind of a saying in the obesity world that the extra fat makes men more like women and women more like men, because the enzyme in the fat changes the testosterone to estrogen and estrogen to testosterone. So all of these things normalize when you lose the weight itself, and doing a keto diet is fine. So I've never prescribed testosterone shots. I know a lot of doctors will do that. Before you lose weight, I just reassure you that I'll help you lose the weight first, and then we'll see after that if you need to have testosterone replacement.
Right. I've got a question from Betsy, and she asks, I am estrogen dominant, and I've heard that eating higher fat affects estrogen. Is this true, and should I be worried?
Well, I don't worry about that when you're eating high fat and low carb. So that's an important distinction. So a lot of the research you're going to hear is based on higher fat diets when people are eating carbohydrates at the same time. And I would say that's, 99% of the research you're going to hear about has high fat in it, but really that was high fat, high carb at the same time. And the reason this is important is that the metabolism totally changes when you're eating high fat and low carb or keto. So when your body starts burning its own fat, the hormonal changes are favorable. And while I haven't seen a study specifically about estrogen dominance, I don't worry about that. And I know a lot of cancer patients are taught by default that you should do a low-fat diet, but there's no evidence for that. One of the biggest studies ever, the Women's Health Initiative, used a low-fat diet for cancer prevention, and it didn't work. And this was published, over 10 years ago. So what you want to do, if you're, like we've talked about with cancer, you want to keep the insulin level down. You can do it in lots of ways. Using a low-carb keto diet does that as well.
I've got my last question, and that is from Tara. And she says, I'm on medication for thyroid and would need to be monitored. Or would these need to be monitored? Do you think this would be a problem? So obviously she's worried that starting a keto diet, she's on medication for her thyroid. You've kind of answered this, but would this type of medication would be one of the ones would need to be monitored while on a keto diet?
Well, my perspective as a clinical physician, obesity medicine, keto specialist, I have the luxury of checking these values, checking labs, blood tests when people come to me. So as a safety, because I'm using this in lots of different types of people with a host of medical issues, I'll monitor what would be typically monitored. And thyroid is not a major issue if you're on a dose that's a stable dose. You don't have to have it adjusted frequently. And typically the way, if you're getting it monitored every year or 6 months, that's probably sufficient. And if you felt like it was getting abnormal, you would contact your physician about it. But to be safest, I would say have your physician monitor that. Having seen so many people do this without me, without physician monitoring or anyone monitoring it, there is a safety tolerability threshold that's pretty big. And, so you could be on medication like thyroid and change the diet and probably will be just fine. But my teaching, because I'm taking responsibility for someone's health, I will monitor those things. But I have to admit, I don't really change the thyroid much. If maybe after years of doing it, so I wouldn't worry about starting a keto diet if you're on thyroid. But I would have it monitored. That's the best thing.
Eric, thank you so much always for your words of wisdom, and I'm sure there's a lot of folks that will really appreciate the information that they learned here today. I certainly did. Thank you so much. For everyone else, if you enjoyed this video, you can find us on YouTube, Facebook, Instagram, and Twitter under the name of Adapt Your Life. And if you're watching this on YouTube, don't forget to hit the notification bell so that you can be alerted every time we post a new video, which is typically on a Wednesday. And if you enjoyed this video, we would absolutely be thrilled if you could give it a like and possibly even a share. That would mean the world to us. This is Dr. Eric Westman and Glenn Finkel signing off on another episode of Conversations with Dr. Westman. Until next week. Eric, I really appreciate your time once again. Thank you so much. Until next week.
Thank you, Glenn.
Thank you.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.